The phone started ringing in 2012. Since then, volunteers with the Idaho Suicide Prevention Hotline have responded to more than 95,000 contacts. Those include phone calls, text messages, as well as online chats. And now the name of the organization is changing. They've been helping those contemplating suicide, those worried about the mental health of a loved one, and those reaching out for resources for themselves or someone they know. Of course, it's open 24 hours a day, 7 days a week. As I mentioned, the hotline just changed its name. The director says the new name reflects the type of support the hotline has always provided, supporting Idahoans in emotional crisis. It is now known as the Idaho Crisis and Suicide Hotline. The phone and text numbers are still the same. They're at the bottom of your screen. You'll see them popping up here in just a minute. And you're also seeing video of the hotline's website, idahocrisis.org. Joining me now is Idaho Crisis and Suicide Hotline Director Lee Flinn. Lee, thank you so much for your time today,
Thank you so much.
So I gave a synopsis there of the name change, but can you tell us a little bit more in depth of why the Suicide Prevention Hotline has now become the Idaho Crisis and Suicide Hotline?
Sure. Back in 2012, when the hotline launched, we launched specifically as a suicide prevention hotline because that was such a missing piece in Idaho at that time. And what we found is, just like you said, as soon as the phone started ringing, it became really apparent that Idahoans were calling for many, many reasons. And one common denominator was people were in emotional distress or some sort of crisis. And oftentimes that was a suicidal crisis. And often it was a different type of crisis, either struggles with mental health issues, relationship breakups, financial difficulties, and many other reasons.
And what happens when someone calls that's not talking specifically about contemplating suicide? Do you direct them somewhere else?
Yeah, so when someone calls, they normally call, they're feeling emotional distress. And so our crisis phone responders will, just get a sense for what's going on and listen to what's going on. And then we do ask everyone who's calling, we do assess for suicide as a safety assessment. And if a person's feeling suicidal, we kind of take that interaction one way. And, other reasons might be somebody might be having trouble with anxiety or a lot of depression. And so if they're not feeling suicidal, we still provide emotional support and help that person decide for themselves what that next step is, whether it's a plan to keep safe or whether it's, how are they going to get through the day.
And really, so it's about any kind of crisis that you can help someone at least get to the resources they need. So therefore, it's now the beginning of the name.
That's right.
Okay.
Yes,
and,
that's right.
So who can call? I think people think maybe it's just the person who may be feeling that way to reach out because they're contemplating suicide. But you can call about a loved one or others.
Absolutely. We encourage everyone to call. A person can call for themselves, and they can also call on behalf of a loved one, a neighbor, anybody, a friend. And we do get a number of calls like that. We get quite a few calls from parents that are worried about their child. We sometimes get calls from therapists who have a client in their, in their appointment, and sometimes they'll put the phone on speaker because they want to let their client know what happens when you call the hotline. So we've had, I can't recall what school this was, but we had a school that was holding an assembly, and they called the hotline and had us on speaker so they could kind of, hear how that goes if you call the hotline. So.
And I know that you've had calls over the years from someone as young as 8 and as old as 93. So there's that wide gamut of age range and socioeconomic backgrounds and whatnot. But May is Mental Health Awareness Month. I'm just curious, you touched on it a little bit, but if someone is nervous about calling, what would you like them to know about what they can expect when they make that phone call about how they'll be treated?
Yeah, we would want anyone to know that when they call us, it is confidential and they can tell us as much or as little as they want to. They don't have to tell us their name or where they live or anything. And, they can hang up if they want to, and, it's really within their control. But I just want people to know that we are there to support them emotionally and to help them through whatever crisis they're experiencing right now.
And I know the volunteers go through quite rigorous training, too.
Right.
So they're ready for any situation.
Right, and we currently have staff phone responders, and we also have volunteer phone responders. So we have quite a few crisis responders.
Well, Lee, thank you for coming in today. Such an important message to continue to get out there. Again, the numbers have been at the bottom of your screen today. You can also find easy information, idahocrisis.org. If you need help for yourself or someone you know, please don't hesitate to call 800-273-8255. We'll be right back with more of the news at 4.